Let's face it, colonoscopy is not the most savory of topics, and what patients have to drink before the procedure might be the least savory of all. On this week's edition of Today's Health, we tell you how doctors are working hard to make the colonoscopy prep much easier to digest. Erica Edwards reports.
We're advancing the scope through the colon.
Allowing a physician to explore your colon for early signs of cancer? Piece of cake.
You're asleep for the procedure, so it's really the prep that's the worst part.
Colonoscopy prep can mean drinking up to a gallon of a laxative to clean out your bowels.
My system, after a certain amount of time, said, no more, and then it all comes up.
Now doctors and scientists are working with a company called Culinary Concepts to make the prep process taste better.
For example, lemon and white chocolate.
One of the researchers is Dr. Douglas Rex of the Indiana University School of Medicine.
We think it's going to be a significant advance in tolerability over the current preparations.
So this is an example of what the experimental food prep would look like. Shakes, food bars, and a sports drink with electrolytes to balance out the system.
Colonoscopy is not the only screening method, but many people who qualify for the procedure don't get it. Some say it's because they can't stomach the prep.
We're simply trying to make that part of it, which is absolutely essential. We can't get away from it to have an effective colonoscopy. We're just trying to make it easier.
The American Cancer Society recommends starting colorectal screening by age 50, earlier if you're at high risk. Erica Edwards, NBC News.
If all goes well, the new prep could hit the market within a few years. In other health news this morning, newborns appear to get important gut bacteria from their mother's breast milk. Scientists at UCLA studied bacterial communities in 107 healthy mother and infant pairs. They found gut bacteria in breastfed babies were more closely related to their own mother's milk and skin compared to a random mother. Experts say these results emphasize the importance of breastfeeding because this bacteria plays an important role in children's lifelong health. New research suggests EpiPens are still potent long after their expiration date. The study conducted by the California Poison Control System tested 31 EpiPens that were 1 to 50 months past expiration. 2/3 of the EpiPens contained at least 90% of the original amount. And a new study reveals cotton tip applicators send more than 12,000 children to the emergency room each year. About 75% of injuries occurred while kids were cleaning out their ear canal. And while most patients were treated and released, some children had damage to the eardrum, hearing bones, or inner ear. Doctors say cotton tip applicators should never be used for ear cleaning because they push wax closer to the eardrum. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.